Hey, what's up, everybody? BDL44 coming at you with another video. All right, another good session with Lydia, man. I think we're starting to get to a point where, you know, they are starting to think that I don't necessarily need the care they provide. They have care for people who have trouble taking care of very, basic things like showering and eating and, being able to find functionality within themselves and working a system that allows them to focus on just the simple things that they have to do. Putting on clothes every day, just stuff like that. I don't have trouble with strengths in mind, And so that's what I'm starting to understand. I'm getting a clear-cut understanding of what it is they do versus what it is that I need. And, the reality is I may need to find a different type of therapist. That's what we learned today. Because she was like, can we focus on coping mechanisms and things like that can get you, what can we do to bring you into spaces that are not as comfortable so that we can utilize our time more effectively. And I'm like, well, that's the problem. It's convincing myself to do those things. I don't think the answer is there. I don't think that that's something I'm really strong at. And so when I say to her, like, I try to rationalize around trying to do things that are going to be stressful or whatever. And she says, well, why don't you just, or not everybody doesn't want to go, but you have to go, that type of thing. It's like, well, that's what I've been struggling with. That's essentially the issue. And so, yeah, I just think I may need a different type of therapist rather than what it is they're providing. And that's just something I got to start looking into, honestly. But I really do enjoy sitting there with Lydia. She's always helpful. She's patient. She's easy to talk to. I'm very pleased with her, her patience with me. But, I think they're just starting to have conversations about the type of care that they think I need. And it might not be what they do. It might, because she's like, are you ready to graduate? I'm like, I still got the same problem. Like, ain't nothing changed. I'm still in the same space I was in when I first started this process. And she was like, well, but you're able to function like I'm always able to function. And the question is, can I perform for a period of time past my threshold? If I will go to work, can I stay there for longer than 3 years without burning out and then retreating to a space of isolation for 18 months, which is basically loosely the cycle. And like, that's not the problem. I never look like I can't function. I never present myself like somebody who can't work as a functioning member of society. And if you found me at different times when I had a job, you wouldn't know anything's wrong with me at all. And go 3 whole years without not having a job and working and all that. The problem is the cycle that I end up falling back into when a certain event takes place after a certain period of time, when I've just burnt out, had enough, can't do it anymore. It's the behavior that comes after that needs to be to change. And so it's like, I just don't know that what they do here really specializes in what it is that I may have going on. And so that's what it really comes down to. And this is the struggle with my mental health, It's like, because I've never been treated, this is my first therapist, so she just as confused as how to deal with me as anybody else was in the past. It's like, I got something specific, fam. Like, there's something specifically going on with my particular thing. And I ain't never seen nobody who has the issue I have. And, it's not something that she was trying to tell me, like, well, not everybody has a problem. It's like, I don't have issues understanding the vastness of others. Some people are struggling, other people are not. Some people are forcing themselves through difficulties. Other people have different thresholds. Like, the vastness and the randomness of the world around me is not something I'm confused by. I don't think everybody's one thing or another. You know what I mean? It's like, yeah, my mind is not simple in any way. Not in any way. When it comes to stuff like that, I ain't simple at all. So it's like, it looks like I may need something a bit more advanced to try to figure out what exactly it is I'm dealing with. And that's what it really comes down to. There's something specific. There's a certain diagnosis that I think they don't know what it is. And that's really what it comes down to. They're not sure what that diagnosis is. I think they're trying to rationalize around the sickness itself. I think that's what she's finding out. So, yeah, man, it's complex, but it's also something I'm willing to work on, man. I want to get answers. I want to change for the better. I want to see things get to a space where there's no struggles, and I hope some of this made some sense, because I know I'm speaking all in circles right now and all over the place, but at the end of the day, we're trying to initiate some change within myself so that I can function for a period of time that ain't just 3 years and then quitting, isolation for 18 months, not being very productive. Like that cycle that I've been in for like 30 years, that can't sustain going forward. So that's really what it comes down to there. So that's what I gotta say. Next video 44. I thank y'all for watching.